The UCAT is a quick and simple evaluation that you can use at the bedside to evaluate a resident's POCUS skills. Let me show you how to use it. These evaluations should ideally happen while you're at work and seeing patients. The resident will usually select the case and find you after they've done their initial assessment. Before they use POCUS, they should come to you with the form and ask you to watch them scan. The UCAT has you evaluate the resident on 4 different domains of skill, including preparation, image generation, image optimization, and clinical integration. Each domain includes a list of key behaviors that you're supposed to watch for. Like for image optimization, you should see them center the area of interest, and they should be able to generate an image of a reasonable quality, which might require them to troubleshoot obstacles like the patient's position or body habitus, and it might require that they fiddle with some of the machine settings like depth and gain. If they do all or almost all of these things really well, then you can give them a 3. If they do most of these things well, you can give them a 2. And if they do only some of these things well or none at all, then you should give them a 1. Remember that one of the domains is clinical integration, so when the resident is done scanning, you'll want to debrief a bit and chat about the case. Make sure you know how the resident interpreted those images and ask them about the next steps in management. After you've gone through all 4 domains, you'll give one final score for their performance overall. This last rating uses an entrustment scale, which asks you to think about how much supervision this resident really needs. If the resident was totally independent and you didn't need to be there, give them a 5. If you didn't do anything but you still felt like you needed to be around, give them a 4. If you found yourself giving hints and reminders, give them a 3, and if you really had to talk them through it, give them a 2. Finally, if they were really lost and you just had to do it for them, give them a 1. At the bottom of the form, there's a list where you can check off which scans were done, and there's also a space where you can include some comments. You might include something here about what the resident did well, or write down a couple things that the resident should work on. And that's it. You can give the form back to the resident, and they'll bring it back to me. Thank you so much for your help with this project and for your commitment to teaching. If you have any questions, please feel free to get in touch. Happy scanning.